All right. Hi, everyone. Thanks for tuning in. I just wanted to talk a little bit today about the importance of treating H. pylori. So, a little overview. First, we'll start about why it's important to treat. Second, we'll talk a little bit about how. And third, we'll talk a little bit about follow up. Okay, so why do we treat H. pylori? Well, H. pylori can lead to stomach cancer if untreated, and I often kind of briefly touch on this with patients because I don't want to freak them out, but I do tell them that treating H. pylori is important. It also can just lead to symptoms of gastritis. That being said, somebody can have gastritis and have H. pylori. So treating the H. pylori might help, but their symptoms of gastritis might persist. So I do try to explain that to patients as well. The second part I want to talk about is how to treat. So my preference is to use quadruple therapy in a patient who can tolerate it. As far as I know, we don't have known resistance rates in Salt Lake City for H. pylori. So it's better to just use quadruple therapy because it's more effective. However, if I do have a really elderly patient or a patient who I don't think is going to be able to understand how to take the medication appropriately, or maybe they have allergies, then I will do triple therapy. This is one thing that might be a little bit different than what you guys have done in the past, but I think it is super important to have the patient come in, okay, to discuss the treatment. So, in my experience in primary care, what I see again and again and again is if I have a patient who was treated with quadruple therapy and the instructions were given to them over the phone by, for example, the nurse from GI or the medical assistant or even the provider, I would say 8 times out of 10 they take it wrong. Okay? They do not take the medication correctly. They get confused. They don't fill it from the pharmacy and they take it wrong. Now, sometimes, even if you take the medication wrong, the treatment will work, but sometimes it won't. And then they have to do it all over again. And this treatment really sucks. So it's just a real bummer if people take it wrong. So my practice has been to tell the patients when I am testing them for H. pylori, hey, if you come back positive for H. pylori, I'm going to ask you to come back to discuss the treatment because it's very complicated and it's important that you take it correctly. One question that might come up when we ask the patient to come back to discuss the treatment, and I think this is really going to just be provider dependent, is whether to have them pay for that visit. And I think just use your best judgment. So if the patient doesn't have insurance, sometimes I do this as a no charge visit. At the North Temple Clinic, we're often not that busy, and I could easily squeeze in a 15-minute conversation to review the treatment of H. pylori with somebody without charging them. If they do have insurance, I go ahead and I go ahead and bill it, and I charge them a 99214. I know that's a discrepancy and might not be totally fair, so use your best judgment on what you think is appropriate for whether to have that visit be a charge or not. Okay, so here is a handout that I've made to give to patients on how to discuss the treatment of H. pylori. I've written it in Spanish because most of the time, the patients that are positive for H. pylori are Hispanic. It is more common in South America. And even if they don't speak Spanish, it's pretty basic. I think people can understand it even if they speak English. I have converted this into a typed version, but for some reason I kind of like the handwritten version better. I feel like sometimes it can be just a little bit more personal. So I have the patient come in and I'll do kind of a little bit of Spanglish, I guess, right now. So this is what I tell them. I say, H. pylori es una bacteria que vive en el estómago y causa irritación y dolor. And then I tell them, el tratamiento es por 2 semanas. So the first treatment is omeprazole. So I tell them, ese es un medicamento antiácido. Okay, so it's an antacid medication that helps calm your stomach acid. and it's 20 milligrams, 1 tablet twice a day. So you should get 28 tablets from the pharmacy. El segundo medicamento es bismuth. So este es también un medicamento antiácido. Okay. Again, 2 tablets 4 times a day. You should get 112 tablets. So this is really important. So I say, ese es también sin receta. Okay. So this happens quite a bit. The pharmacy, so bismuth is a medication that's over the counter. So a lot of times the pharmacist won't fill it, but they don't tell the patient. Okay. So I write on my prescription, I say, please either fill the prescription or show the patient where to buy it over the counter, okay? So that they know exactly where to go and what to buy. Because half the time, if they don't know that it's not, they might not get it from the pharmacy, they just don't take it. So I've seen tons of patients where they just don't even take the bismuth component, okay? The third medication is tetracycline, y esto es un antibiótico. Y con este medicamento lo que tiene que hacer es cuidarse del sol. So you have to be careful in the sun. Este medicamento es 4 veces al día. Y el último medicamento es metronidazole, que también es un antibiótico. And with this one, no beber alcohol. Okay. So do take note on this page that the metronidazole should be 500 milligrams. The papers that I have in clinic do have this kind of scratched out and updated to 500 milligrams 4 times a day. And then I say, lo más importante es que toman todos esos medicamentos al mismo tiempo. Okay, so if you go to the pharmacy and they give you, this happens all the time, they give you omeprazole, bismuth, and tetracycline, and they say, come back in 3 days for the metronidazole. Or they give you, 3 of them, and then they say, here's half of this prescription, come back in a couple of days for the rest of the medication. It is so important to tell the patient, wait until you have all of the medication together and then start the treatment, okay? The other thing to keep in mind is that some of these times we will already have prescribed a PPI because they came in for gastritis, so we prescribed a PPI already. You need to double check that they will have enough of the omeprazole. If, Susie prescribed it yesterday, well, did she only give 30 tablets and they've already taken it for 5 days? Well, then they're not going to have enough for them to take the 2-week course. So be really cognizant about that as well, okay? I've created this little table for patients so that they know how to take the medications because there are just so many pills, okay? So the first one is omeprazole, and this one va a tomar 30 minutos antes de desayunar y 30 minutos antes de cenar. Y es con el estómago vacío, okay? Tiene que estar con el estómago vacío. And so then I kind of show them, okay, so that's when you take this one. Okay, las otras tres están juntos. So bismuth, tetracycline, and metronidazole you can take together. So you can take it con el desayuno, con el almuerzo, con la cena y antes de acostarse. Y son todos juntos, okay? This kind of tells patients how to take the medication. The other thing I tell them is, nos tiene que llamar, okay? If you have any problems with filling the medication at the pharmacy, or if you're having nausea and not able to take the medication, or it's causing too much diarrhea, you need to call us. We are not going to know if you have a problem unless you call us. So call us and we can prescribe Zofran, we can prescribe loperamide, or whatever you need to help you get through the course. But it is super important that you take all of these medications. I will also often hold other medications because I see them in primary care. So I'm like, okay, let's get you through the treatment of H. pylori, and then we'll focus on treating your blood pressure later, not starting losartan at the same time as all of these medications because it's just way too much. So then I tell them, take all of the medications with lots of water, and then 4 weeks after taking the medications, we have to repeat the H. pylori test. You can do this through the stool antigen testing or the breath test. We have the breath test at North Temple, and I think it is pretty easy. Patients like it. Es muy importante. So you can't take omeprazole in the 2 weeks prior to the H. pylori test. Otherwise, it can cause a false negative. So the last part of it, we I guess we kind of talked about, but is the follow up. So the follow up testing is so important, and I see this missed in primary care all the time. They were treated for H. pylori back in 2023, and they never had a follow up test of cure. It's extremely important to get the follow up test of cure because if we didn't treat it appropriately, well, then they're still at risk of developing gastric cancer in 25 years. You know what I mean? So it's very important to tell them that they have to come back for follow up testing. I actually usually postpone this like 2 months out because I say, okay, well, it's going to take you a week to get the medication from the pharmacy. Then you're going to start the treatment. Then life happens. So let's just do it in 2 weeks and scratch that 2 months. That'll be enough time because you don't want to do the test too early. If you do the test too early, they might still be positive, and so that you don't want that. That would be bad. And then I also tell them, I usually do this at the beginning, but I talk to them about H. pylori and how it's transmitted. So it's transmitted in a fecal oral fashion. And so I tell them, you can't be sharing drinks with anybody while you're taking the treatment. No kissing your partner, wash your hands super good. And then I tell them if your family members are having symptoms, they might want to come and get tested as well. Testing children is a whole nother story, and we don't typically test children for H. pylori. So I tell them, probably better to not have your kids come in because who wants to have to make their kids take this awful quadruple therapy? And I don't know the science behind it, but all of UpToDate says like typically don't test kids for H. pylori. So I leave that to GI. But if your other family members have symptoms, they might want to come in and get tested. Even if they don't have symptoms, I kind of just leave it up to them. H. pylori is also, I believe, can be found on like contaminated fruit and water, like ice and things like that, more common in South America. So, we can never tell people like, where did you get this? But I say, like really be careful about this oral fecal transmission while you're being treated until we know that you've had a negative test of cure. So happy to answer any questions and share all of this information with you guys. I hope you're having a great day. Bye.